breast cancer surgery was very different from what I had learned. As of 2021 or 2022, breast cancer is now the commonest cancer in the world as well as in our country. There are only two things in breast cancer surgery. Either you remove a breast or you just remove the lump. Breast cancer was supposed to be a disease of the affluent, a disease which is much more, the incidence is higher in the West. So it's not just the estrogen hormone or not just the worsening of the diet or our lifestyles. It's a lot more. There are environmental factors as well.
Dr. Manjula, it's such a pleasure having you here. I know you've been an advocate in trying to spread awareness on breast cancer, and you actively been speaking on a lot of platforms. It's such a pleasure that you came here and took out time to speak with me. So you are the lead consultant breast surgical oncologist, and you specialize in oncoplasty and minimally invasive breast surgery at Apollo. Tell me, doctor, what drew you to this career?
First of all, Rashmi, hi. Thank you so much for having me here. I think we look forward to as many opportunities as possible to kind of spread our message on breast cancer awareness. So no matter how much we do, it's never enough. So thank you very much. I trained in general surgery. I did my master's in general surgery. And after that, there comes a time where you get to choose. And I was very interested in plastic surgery. So I'd moved to Bombay after my master's, and I was working at Hinduja Hospital. And, I got to work with surgical oncologists. And that's when, while working with one particular, I was posted with a breast cancer surgeon. So, no matter how much I would want to do plastic surgery, somehow I kept being posted with surgical oncologists. And that's when I saw that breast cancer surgery was very different from what I had learned. So, what we had learned was, there are only two things in breast cancer surgery. Either you remove a breast or you just remove the lump. And honestly, I thought there's nothing much to this. It didn't excite me. I was more interested in plastic surgery and reconstructing breasts and, making women happier. But then, when I worked with my mentor, Dr. Vinay Deshmane, at Hinduja Hospital, my views changed entirely. I realized that breast oncology was a lot more than just cutting off the breasts or just, doing a lumpectomy. There was so much more to the biology of breast cancer, to the character of the disease. And I realized, and, more so, I'm sure we will talk about it, further, that there was something called Oncoplasty, wherein you use breast reconstruction techniques of plastic surgery to help cancer patients reconstruct their breast and match it to the opposite breast. And that honestly fascinated me. I mean, what more, when a woman is faced with such a challenging period and, having to face the trauma of losing an organ, and you are able to help save the organ, not just reconstruct it, but also match it to the opposite side and probably give, her an improved sense of body image, add to her confidence, it really improve her quality of life. That fascinated me, and that's what drove me to this field. And since then it's been 12 years, and as they say, that's history.
Doctor, so you've been in this field for over a decade now. Do you think there is an increasing trend or a changing trend on the causes that, on the what are the triggers that cause breast cancer? Have you observed any changes?
Absolutely. So, this has been documented in literature. The World Health Organization has also released the data. The rates of breast cancer are increasing at a rate of 0.5 to 1% every year all over the world, including in India. As of 2021 or 2022, breast cancer is now the commonest cancer in the world as well as in our country. And, to sort of just give you an idea of what that means, in the 1990s, right? Breast cancer was probably the fourth or fifth most common cancer, and the incidence is rising at the pace at which it's increasing. Now it's the commonest cancer. So definitely, it is on the rise.
And what is causing it? Like, what are the external impacts that trigger breast cancer?
See, it has mainly been attributed to a westernization of lifestyle. Breast cancer was supposed to be a disease of the affluent, a disease which is much more, the incidence is higher in the West. So, all your factors which contribute to a westernization of our lifestyle, be it the diet, be it, the increased, say, smoking, alcohol, also, certain, this may be a little controversial when I say it here, but breast cancer is mainly a hormone related disorder. It's dependent on the estrogen hormone, which increased levels of which is set to increase a woman's risk of developing cancer. So certain lifestyle choices like choosing to have a child after the age of 30, or choosing not to have children, or choosing not to breastfeed, these are factors which will increase the levels of the estrogen hormone. So automatically that does translate to an increased risk of developing the disease. Does not mean that a woman who has had 5 children or say even 10 children will not develop the disease. She may also develop breast cancer. But, these factors, nulliparity, not breastfeeding, they do put a woman at a slightly elevated risk.
Doctor, what is the impact of early intervention in this condition?
Early intervention is everything in breast cancer treatment, right? What we notice is that in society, there is absolutely no awareness about breast cancer. There is fear. The word cancer elicits a lot of fear amongst, they think it's a full stop. They think it's the end of everything as they know it. But what I would really like to inform everyone, tell everyone that this is not the end. In fact, breast cancer is a curable disease. The rates of, the 5-year survival rates of patients having undergone breast cancer treatment, for those where it's been caught very early and not yet spread to the distant areas or the lymph nodes, it's as high as 99%. So when your survival rates are more than 90%, it's amazing. So it's a disease that can be cured. It's a disease for which today we have so many more advances where women can lead, continue to lead lives the way they have, they were before their breast cancer diagnosis, and also their quality of life may not really be impaired.
What percentage of women do you see who miss out on early detection even today, after all the work that goes into education and awareness? Do you still see a huge percentage of women who have actually?
Absolutely. So there's not a lot of work. Of course, we doctors do keep talking about it, breast cancer awareness, and how to detect. Please go for your screenings. But it's not enough for a country of our size, for the population that we have. Probably the people that I'm speaking to, even this podcast that I'm doing, how many people would it reach? And probably people who have access to the internet, and that would mean maybe in the metros only. But a large percentage of our population who are in the tier 3 cities or in the villages, they are the people whom we need to reach out as well. So we need larger efforts. We need the government to get involved. We need the media to get involved. Or we need concentrated efforts towards driving awareness towards breast cancer. So what does that mean? Teaching people what are the causes of breast cancer, letting them know that it can be cured, letting them know what are the different kinds of treatment, what do they need to do for early detection. So now that the first thing that you asked me was, what is the percentage of people, who still come to us with advanced disease? So let me tell you, it's 60%. And, to put that into perspective, if you compare India to the West, while the incidence of breast cancer in the West is very high compared to India, but the mortality, the number of people who die from the disease are higher in our country than in the West. And why is that? While 60% of the population or the patients who we see in our clinic today come to us in more advanced forms of the disease. In the West, that is only 10%. So you see the disparity there. So a lot of work still needs to be done to eliminate fear and to spread awareness.
But doctor, I mean, this is very surprising for me because we always assume that tier two, tier three cities have the people have a far healthier lifestyle. So this increasing trend in breast cancer is still there in tier two, tier three cities as well.
It's supposed to be a disease of the affluent, but if you see, our lifestyle does not just depend on what we do or how we do it. It also depends on our surroundings, the water we drink, the food that we eat, what goes into the food that we get. Air pollution has been, I think 2 years ago, there we have the evidence to show that air pollution also causes an increase in the incidence of breast cancer. So it's not just the estrogen hormone or not just, the worsening of the diet or our lifestyles. It's a lot more. There are environmental factors as well. Um, Only 10% of breast cancer is attributed to genetic causes. The remaining 90% is said to be sporadic in nature. A lot of environmental influences and all of these. So there's not one particular reason that you can say, like for example, excessive smoking causes lung cancer. No, breast cancer is a lot more than that. So it's multiple influences that come together, give rise to a mutation which can finally
So from what age do men get breast cancer?
yes, men also do get breast cancer, and this is a fact that is not commonly known to people. But the incidence is a lot less. So the only 1% of the men do stand a risk of developing breast cancer, but they do get. So we do tell men as well that you need to know your family history. If there is a mutation that's going on in the family that's being transferred across generations.
So even if the mother has had breast cancer, the son can also get it?
Yes, they may. So, but it's not a mandate. So, like I said, 10% of the breast cancer cases are attributed to family history or genetic mutations. So, when a patient is diagnosed with breast cancer, there are certain criteria by which sort of hints to us that this could be genetic. So, then in that case, we recommend genetic counseling and genetic testing. And if the patient does test positive for a genetic mutation, then we have a discussion with the family members, explaining to them what is their risk of developing the disease, and then give them the option of testing themselves as well. The other thing that people in general ought to do is be very mindful of their bodies. So men as well, be mindful of any lumps that may be appearing on their chest or close to their nipple, areola, any changes like a wound that is not healing, some bleeding, any lumps
Anywhere in the body.
well, anywhere in the body. But for breast, then if you're talking about breast cancer, particularly, I would specify the chest area, around the nipple and the areola, in the underarms and the neck.
And doctor, like I just wanted to understand that from what age do women start being conscious about self check and or is there no such thing like everybody needs to be aware?
I would say 18. Look, mindfulness is something that is a very, very important aspect. And, thanks to our busy schedules and our lifestyles, and we're looking after our families, a lot of women don't pay enough. What do you say? They're not very mindful about their bodies or their health. How many of us, when we take a shower in the morning, are actually aware of, if there are any new lumps or bumps in our body? We'll just be taking a shower and our minds will be elsewhere. So, self breast examination is a easy enough exercise, hardly takes any time. And I would recommend that every woman, starting from the age of 18 and above, practice a self breast examination. It is a simple technique where a woman just needs to use the pads of her index, middle, and ring fingers, like you take an oath. So, how I always tell women is take an oath to look after your breast health today. So, use the pads of these three fingers in order to examine your breasts. And why we specify pads of these three fingers is because a lot of women come and tell me, Madam, I keep checking my breast, but everything feels lumpy. Why does it feel lumpy? Because they're clutching at their breast using their thumbs as well. So when that happens, the breast is an organ which has fat inside, a lot of glandular tissue inside, has a lot of undulations. So everything will feel like a lump. What they ought to do is press the breast tissue just using the pads of these three fingers on their chest wall and run it down. So if there is a lump beneath the skin, their fingers will run over it. Similarly, they ought to be mindful about any changes. Like just similarly, just like for the men, any skin changes around their breast and chest and neck area, any lumps, any bleeding, a wound that is not healing, a nipple discharge. So by nipple discharge, I don't mean, they keep pressing their nipple and to see if there's any discharge coming every day. They need to see if there is a spontaneous nipple discharge on their bra or their clothes that they're wearing. So if they see their bra or their clothes getting soiled every day or some, getting wet, then that is something that we need to look at. So these are, if there's a sudden change in the nipple gets pulled inside. These are things that they ought to notice and bring it to the attention of their doctor.
Is there something you would like to, tell women, before we move to the more detailed topics around breast cancer, on, being able to talk or, being able to make themselves aware about breast cancer and let their friends and family know as well? Would you like to share?
Well, there are a couple of things that I would like everyone to know. First of all, screening is very, very important. So while we spoke about self-breast examination for all women starting from the age of 18 and over, right, I would recommend breast cancer screening for every woman starting from the age of 40 and over. So by that, I mean that a woman ought to start getting a mammogram done once a year, right? It should be part of her regular health checkup and annual health checkup, right? So a mammogram is basically an x-ray of the breast where the breast is compressed for literally 30 seconds. So a lot of them get worried it's very painful, but that pain, it's not always painful. Some of them have very delicate breasts, but that pain is very temporary for 15 or 30 seconds, and it's an x-ray of the breast. So why? Because, self-breast examination or seeing your doctor once a year, we're able to detect lumps that may be slightly bigger or palpable. But doing a mammogram once a year helps to catch lumps which have not yet, or very, very early breast cancer which has not yet formed a lump. So we can address it earlier. And women before the age of 40, I would recommend self-breast examinations and seeing their doctor once a year for a breast checkup.
Thank you, doctor. Thank you so much. And I'll meet you in the next episode.
Sure. Thank you very much.